Thank you.
Have you had filler and Botox
No.
in the past? Oh, you're in for a wonderful surprise.
Really?
First of all, let's start off with taking some pictures. I'm going to go get the doctor. She'll be right in to answer all your questions.
Thank you so much.
Okay? All righty.
Thank you.
You're in great hands. Don't worry.
Oh, I appreciate that. Thank you, Janet.
Hello.
Hi, Dr. Lotsikas.
Hi, Christina. Nice to meet you.
Thank you, thank you.
What brings you in to see us today?
I think I've waited a little too long. I have some lines, big lines, because I'm very expressive. Probably the sun, driving, and I sleep on the side.
Okay.
I feel like I've neglected myself, even though I've wore creams. Obviously, it's not working. So I've come to you today to think, is there any hope?
Absolutely. I think you have beautiful bone structure to start. You've got very nice cheekbones, and everybody, as we age, we lose volume in our face, and it starts here and starts migrating down.
Okay.
So we want to address that, not just by filling lines, but sculpting the face, softening this face, softening the lines so that you still look like you and not somebody different. I take a very, very natural approach, which I like, but that you look maybe rested, 5 to 7 years younger, but you still look like you. I'm going to get a mirror and we're going to take a look together what we want to address, and we'll go over my treatment plan, and then we can get started.
Thank you. And I feel like I have some droopiness there.
Some of the droop there.
Yes.
Okay. You need a lot of product. You need it in the right places.
Oh, I like the way you said that.
That's what I would say for you is that you really need product, but you need product in the correct places. Placement's very important, and that's what's going to make a difference, because it is a sculpting, it's an improvement, it's a softening. Okay, Christina, I'm just going to clean off your face a little bit here. Cleansing before any procedure is super important. I'm going to take a look. Also, when we really evaluate a face, we look at the face in animation. So it's not just a face at rest. You need to look at the face with the movement. Like you said, you're very, you like to animate, you're expressive. So that's super important. So you've heard about Voluma.
I have, yes. That seems like the new rage.
So Voluma's been out since 2013. I love it. It's one of my favorite fillers. We use it in the mid-face. It now has an indication as well for the chin and jawline area. Again, you have beautiful cheekbones, so you're not trying to make them larger. You're just trying to lift up where there's some deficiency to kind of bring up the skin, to give a little bit of a shaping to the face and lift to there. All right, Christina, you ready to get started?
I am. Thank
Wonderful.
you.
And let's reiterate that you're 57 years old. You've never done anything before in your entire life. You exercise and live a very healthy lifestyle.
I do.
So there's going to be a little pinch. Okay. Be all right. There's some numbing in this, so little beginning. You feel a little pinch, but it's not too bad. This is the Voluma that we're using that you've heard of. So I'm just massaging in the product a little bit in the cheekbone here area. It's a little bit thick. Everybody injects a little bit different, but I like to kind of mold it into place.
Okay.
Oh. How does that feel, Christina?
That's fine.
Out of a scale of 0 to 10, what do you feel with the injections?
Is it possible to say 0?
Really?
I'm okay.
You didn't bother you at all? And
Okay, 1.
And you have a pretty good pain tolerance.
I have a good pain tolerance,
well, that's important. Janice brought me a little more product and some Botox for after we get this done. Yep, it's already started to lift on this side. Yeah, I can already see that this cheek side is actually higher than that, and some of that crepiness that was kind of that skin coming down has been pulled up a little bit. So I've used about a half a syringe of Voluma on your left side, and I have another half in my syringe to start working over here. You don't want to put too much because, again, you already have very nice high cheekbones, but we just want to put it where we want to get a little lift. This is my favorite procedure because I feel like you can make such a significant difference for patients, but they still look like themselves. So now I'm going to move on to the Juvederm.
Okay.
Also hyaluronic acid. It's in the same family as the Voluma, same company. It's just a different cross-linking and of the actual molecule that's used more for the lower face, where the other one's used more for the upper face. or for the chin. It just depends on where we're working.
Okay.
All right, just going to do a little here. This may be a little more sensitive than the cheeks. As we move around the mouth, it tends to be a little bit more sensitive.
Okay.
So I like to do a little massage here in the office. You don't need to do anything after the procedure.
Okay.
Ice is very important after the procedure to avoid bruising, swelling. The more you ice, an hour or 2 if you want, after the procedure, that helps to decrease bruising and swelling. An ice pack, but not direct ice on the skin. Some of those little like kids boo-boo kind of buddies type of things, or a bag of vegetables, but not on the skin. Put it inside a Ziploc so that it's clean. Again, you don't want anything on your skin that could cause an infection, so you want to keep the skin clean and protected. In the evening, you can wash your face, gentle cleanser. No retinols, no glycolics, nothing that would be harsh on your face.
Okay.
And I will give you written wound care instructions, post-care instructions of what to avoid. No exercise today. Don't drink any alcohol today. If you have any discomfort, Tylenol is okay, but you want to avoid Advil, ibuprofen, Aleve, anything that would thin the blood that could contribute to bruising. In the case that you do have bruising, bruising is a known accepted side effect of the procedure, and it typically will go away between 7 to 10 days, and you can wear makeup to cover it starting tomorrow.
Okay.
Okay. So I've done the Botox around your eyes, in between your eyebrows, and on your forehead. And as we talked about that, you will not see results for about 10 days.
Okay.
To see. We'll follow up in about 2 weeks to see if any touch-up is needed, but hopefully everything will be perfect. But if we need to add a little more, we can always do that at that time. And I'm just going to take a look here at the filler and see where I want to maybe put a little bit more, and otherwise I think you look pretty good, and I can't wait to see what everything looks like in about a month.
Okay. I appreciate this. Thank you so much.
Hi, Christina.
Hi, Dr. Lotsikas. How are you?
Good. How are you doing?
Very well, thank you.
You look fabulous.
I know. I'm so excited.
You look great.
I do. Every time I look in the mirror, I am so excited. I look like myself, but just a little more youthful.
You look more youthful. You look fresh. You look relaxed, and really nice. Good. I like it.
Thank you.
All right, perfect. Good. Everything looks nice. Cheekbones look great. The lines are softened. I know this side we had a few more of those lines on that side. It's the left side of the face, a little more sun exposure. You may sleep on that side.
I do, right.
But it looks great.
Thank you.
Very natural.
Very pleased. Oh, good. Thank you. And then I would like to keep this up, but I don't want to wait till I go back, like back in December when I was coming in. I don't want to look drawn.
Perfect. So fillers last anywhere between, they last up to a year, honestly. But we like to add, and I like to build. So we don't do too much at one time. We do a little bit, and then we build, and then we it holds, and then we build a little bit more so that we maintain the filler looking great all the time. We maintain the structure of your face. You look like you, but you kind of stop that aging process. We're building collagen with the filler, which is very important. So I would say in about 6 months, summertime, something like that, we could do a little bit just to kind of soften it, keep it there. I recommend, depending on the age of my patient, their lifestyle. I know you exercise a lot.
Right, that's my job.
That's your job, so that exercise and running, sometimes that increases the metabolism of Botox especially, and sometimes the filler, so that your body breaks it down a little bit quicker than maybe somebody else. So I say definitely within a calendar year, but I would say in about 6 months to 9 months, we definitely should do a little filler just to kind of maintain it and keep you looking like beautiful. You'll improve upon it, you'll soften it up, and then you'll always look great.
Oh, great. Okay, I'll do that. I'll make that appointment.
Okay, perfect. So I look forward to seeing you. But like I said, we'll just do little tweaks, and we'll keep it looking gorgeous.
Thank you. I'm very happy. Thank you so much.
So nice to see you. I'll see you
Pleasure.
soon. Okay,
Thank you. Bye.